Namaste. I am Dr. Shantakumari from Mada Ayurveda Eye Hospitals, Trivandrum. Actually, I am now facing you to discuss something about diabetic retinopathy and its possibilities and its line of treatment, etc., according to Ayurvedic principles. Actually, there are so many people having different types of doubts about this condition. So, people used to ask many questions to me. So, I will take the questions one by one and will answer according to Ayurvedic theory. Okay? One of the question is, the patient usually asks, when a diabetic patient has to go for a consultation of an ophthalmologist, whether a consultation of an ophthalmologist is compulsory or not. Okay, very relevant question. So, I am trying to answer this question. Let us take 3-4 conditions or situations that a diabetic patient come across. One is, it's a diabetic patient and there is no any ophthalmic complaints, not at all any visual problem. So he is doubting whether there is a necessity to consult a doctor, eye specialist. That is one situation. Another situation is that he is having some problems, not a serious thing. So he thinks that maybe due to the problem of the spectacles, he may be using spectacles for a long time and frequently changing. And at that time, he may be feeling some small disturbances. When changes the glass, it becomes normal. So he thinks that is due to this spectacles problem. So he usually goes to an optometrist or this spectacle shop and get it changed. Third situation is he is having mild ophthalmic problems, so he takes a decision to consult a doctor. When the doctor checking his eye and conducting all examinations, and after that he says, okay, now there is no problem, you need not be afraid, but you have to do this examination checkup periodically. Sometimes monthly or sometimes once in 2 months, like that. So he is happy and returns, but thinks, why I have to go periodical checkup? That is another situation. Yet another situation is that there is some serious visual problems, maybe all on a sudden or gradually. At that time, what should be the decision, whether to go examinations or Ayurveda or allopathy, like that he is confused. Now let us take the questions one by one. First one I told, there is no any visual problem, any eye problem, but whether there is to go for a doctor. Of course, they have to go for a checkup because there are so many complications, eye complications in a diabetic patient. Not only retinopathy, there are diabetic cataract or glaucoma or diabetic maculopathy or different types of inflammations. These are all may arise as a complication of diabetes. So we had to rule out. Especially when there is a chronic history, more than 5 years, more than 10 years, like that, then compulsorily has to go for an eye checkup and see whether there is any possibility in future. Okay. Then second I told, there is no problem at present, but when he goes an eye checkup, the doctor says, yes, you have to go for an exam checkup periodically. That is very important point. If a doctor says like that, we have to understand that there is a possibility of complication later in future. Okay. Then what is that possibility? Most probably may be either diabetic retinopathy or diabetic cataract or something else. So, In this situation, we have to take steps to prevent that possibility. Don't wait to get it manifested or developed. To take firm steps to avoid that possibility. Here I will say there are so many measures, preventive measures in Ayurveda to avoid the development of diabetic retinopathy in a diabetic patient. If already happened, it is so difficult. Everybody know prevention is better than cure. So once it is developed, the steps are different. But the preventive measures are easy and better and more easy. Okay, so here is the prime importance of having preventive steps. The diabetic retinopathy means there will be hemorrhage in the eyes, there is leakages and sudden loss of vision. Anything may happen. So take steps to avoid it. That means if a doctor says you have to go for periodic checkup and then we have to be alert and go for preventive measures. Take a second opinion and take preventive measures. Okay. Then the another situation, when there is a problem, he is directly going for a change of spectacle. That is a wrong decision. Don't do it like that. There are so many situations where there is a visual problem may develop. It may not be diabetic retinopathy. It may not be cataract. So many other situations. So don't take self-decisions about a diabetic complication. Sometimes in early stages of retinopathy, some changes, some betterment may be seen by changing the spectacles or using high-powered glasses. So that is not a wise decision. So if you have any visual problems and if you are a diabetic patient, don't waste time. Go for a expert opinion. Okay. Then next is there is some visual problems and making some some home remedies or some simple medicine like that. That also is a wrong decision. If there is a vision problem, always take the best decision and go to an expert doctor. And sometimes by early treatment, you can protect your vision. You can save your eyes. And another situation may arise sometimes because of one system and doing treatment in one eye through one medical system and is not getting betterment. Go for a second opinion. Then continuing the same medicines. Because in some patients, some treatment may be helpful and some other people it may not be helpful. So, if you see that there is no betterment in one treatment, better to have a second opinion and better to have a second line of treatment. Okay, this is my advice. Don't waste time. And if you are taking preventive measures in time, you can save your vision, you can protect your eyes. Okay. Namaste. I am Dr. Shantakumari from Ada Ayurveda Hospital. What I am telling here is from my personal practical experience for the last 40 years. Thank you.